हेलो फ्रेंड्स, आई एम डॉक्टर सचिन भोसले फ्रॉम फोर्टिस हॉस्पिटल मुलुंड। आज हम बात करेंगे मेनिस्कल इंजुरी। टुडे विल टॉक अबाउट मेनिस्कल इंजुरीज। Meniscal injuries typically happen inside the knee joint. This is a model of the knee joint and it is showing that between the two bones there are these cartilages which we call meniscus. इसको हिंदी में बोल सकते हैं हम गद्दा, जो कुशनिंग है. There is a cushioning between the femur and the tibia bone so that we are standing on the knee joint without touching bone to the bone. But there are instances, kabhi we get damage to this meniscus. There are mainly 4 type of damages to this meniscus. As we get old, ये meniscus को wear and tear के वजह से you tend to get a tear in the meniscus. The symptom of which is pain on the side of the joint and which normally improves after taking certain supplements. Second type of tear is a typical tear which footballers or badminton players or any sport players get when they tend to twist the knee and the meniscus gets torn. When the meniscus is torn and flipped inside the joint, we have to do a surgery. By doing a keyhole surgery, दूरबीन डाल के वो meniscus को हम stitch कर देते हैं. That's the second type of injury which is very common. There are different types of meniscal injuries described. There is a vertical tear, there is a horizontal tear, there is something which we call a bucket handle tear, and then there is something which we call a parrot beak tear. Okay, so these are the 2 or 3 types of tear which we know. When we examine the patient, we know what type of tear they may be having inside the knee joint and how that we need to treat. Usually, arthroscopy is required to treat meniscal tears. There is another type of tear of the meniscus which we did not know until many years back. As we started doing MRI scan of the knee more and more often, we found out that middle-aged people, often they twist their knee and they get sudden pain in the knee joint, and that is because of what is now we know about is a root tear. A meniscus has got 4 roots. That's one meniscus, a root in the back, root in the front. That's another meniscus, root in the front, root in the back. And when it gets uprooted, okay, that's what is known as a root tear. Once the meniscus root gets torn, the meniscus बाजू में हट जाता है, and then we get bone on bone contact of the knee joint, and that is the start of osteoarthritis of the knee joint. Once the osteoarthritis of the knee joint starts, घुटना घिसने लगता है, तो eventually a total knee replacement is required. So we are very sort of vigilant about this कि हमें ये देखना पड़ता है कि किसको root tear हुआ हो, और that we can repair by doing a arthroscopy. Thank you.